Hello and welcome to your Pixalere Basic Training Part 1. This YouTube video is to be completed with the self-guided training found on the Pixalere ExtraNet webpage. We will review icon navigation and demonstrate a basic wound assessment. Next, we'll complete a partial assessment, close a wound, and discharge a client.
Documenting in Pixalere provides a good overall understanding of the progress of the wound, easy consultation with the wound care clinicians, and improved wound healing times for patients.
Let's begin by logging into Pixalere.
The first screen to pop up is the recommendations from the NSWAC or wound care clinician. These recommendations will appear again when you access the client's chart if they have not been acknowledged.
Charting is completed by selecting the navigation icons from left to right. The patient icon provides an overview of the patient's health history and includes comorbidities, factors that affect healing, and the limb assessments. The wound icon includes the cause of the wound and the goal of care. The assess icon is where you chart the wound and skin assessment. The treatment icon is where products and the care plan are entered. The summary page includes progress notes and is where you can ask for input from the NSWAC. The viewer icon is where you can find all previous charting, including care plans, measurement graphs, and photos for all wounds. The admin icon is where you can admit, transfer, and discharge a patient. The library icon has a link to the web page connecting learners with knowledge, which has wound product information. The library icon also contains paper copies of the lower limb assessments.
Let's begin by admitting a patient. We've selected the admin icon, then we'll enter in the client's public health number or last name and select search. If the client has already been seen by another site using Pixalere, you would click admin function to transfer them to your site. As this is the first time Mr. Test has had information charted in Pixalere, you would click create Pix account and complete the required fields. Next, we will complete the patient profile screen. It covers the overarching information about a client. We have to highlight and then select Add. Filling this out reasonably thorough helps the wound care clinician make recommendations. As Mr. Test's wound is on his leg, a basic lower limb assessment will need to be completed. If abnormal findings are found, then an advanced lower limb assessment will need to be done, time permitting, or scheduled for the next visit. This will need to be updated every 6 months and is important for treatment plan decisions. You can find a paper copy to print in the library icon section. Select New Wound Profile to add a wound. Select the location from the drop-down box, then click and drag the alpha onto the blue person. You can drag multiple alphas if there are different wounds. Please note, you would use your clinical judgment on whether they all need to be documented on. Often documenting on just the biggest or most complex wound will do. Complete the fields, keeping in mind the more information the better for the wound clinician to make recommendations. Do not oversimplify the history. You have to click Highlight before an etiology will appear in the drop-down box. You would enter a patient safety and learning system incident number if the wound was a pressure injury or safety event or near miss related to the wound. Complete all of the fields. Only the fields with red asterisks have to be completed. Notice the mini library icon. It contains helpful definitions. When attaching photos, the first image is a close-up shot of the wound, as is the second image if needed. The last photo is a photo taken farther back from the wound, so the next clinician can see where the wound is on the body. If you're having trouble finding your camera on the computer, make sure you've turned it on after attaching the USB cord. If you can't find your work phone on the computer, be sure to unlock it and select Allow after attaching the phone to the computer via the USB cord. You can find dressing products by searching by category or entering in the first letters of the product. Select and add. You can also remove or update. When keeping track of packing, you only count the pieces in the wound, not outside of it. Wound care frequency refers to how often the wound is having a dressing change. Visit frequency is how often the nurse is doing the wound care. Here, Mr. Tess is coming in to see us every 4 days, but is changing his bandage on day 2 at home. The summary page contains a review of all your charting. Enter any progress notes related to the wound here. Click Referral if you wish to have a response from the wound clinician. If you just want to send them a message but do not need a reply, then send them an FYI. If you select Urgent Priority, you need to phone the wound care clinician and leave a message. There are various instances to refer to the wound care clinician. Please refer to the self-guided training, which links to the Skin and Wound Manual for details.
The viewer is a handy section to view the progress of the wound. We will quickly run through the highlights. The patient flow chart shows the patient's age and health history. The Investigation tab shows blood work entered in the patient profile. The limb and mobility flowcharts show the various completed assessments of these types. The Photos tab enables a handy comparison of the wound at different points in time. The progress notes contain all the nurse's notes, including the NSWAC's recommendations. The wound flow chart shows the history and cause of the wound. The assessment flowchart shows previous nurses' charting, including the wound bed percentage and the amount of drainage. This is where you can go in and edit your own charting within 30 days or add a photo after the fact. At the bottom, it also has a delete charting option if you charted on the wrong patient. The measurement graph tab is excellent for checking the progress of the wound. The product history is helpful when looking to see how long antimicrobials have been used or if the patient has tried a certain product. The treatment plan shows the different care plans.
It's been a couple weeks since we saw Mr. Test, so we will need to review his chart in Viewer. Enter in his Pix ID number. Selecting different photo dates is handy for comparison. The wound flow chart for the cause of the wound is useful if you are unfamiliar with the patient. A quick look at progress notes and wound care clinician recommendations and the treatment plan will have us ready for our visit. After you've completed the wound care, you'd run left to right as before. Update the patient profile changes. Click through the icons completing fields. On the assessment page, we'll select partial assessment. If we've done photos and measurements for the weekly update, we'd select full assessment to pre-populate the work. Great news! Mr. Test's wound has healed. So we'll open his wound and click close in the assessment screen. We do not need to complete any further fields and can jump to the summary page to save. Next, we'll select Admin to discharge Mr. Test